So we can start. Okay. So till the last video we were discussing the Vamana Virejana Shuddhi we have discussed. Okay. So the next one is according to Kashyapa, which are the Shuddhi. Okay. So Vamana Vega. Okay. So Kanishta Shuddhi, that is Abara. It is 2 to 3 Vegas. So 2 or 3 Vegas only the patient has done Vamana Karma, that comes under the Abara Shuddhi. Madhyama Shuddhi is 4 to 5 Vegas, and 6 to 7 Vegas if the patient is getting Vamana, then it is Uttama Shuddhi. This is the according to Kashyapa Shuddhi Krama. Okay, Avara Shuddhi or Kanishta Shuddhi is 2 to 3 Vega, Madhyama Shuddhi is 4 to 5 Vega, Uttama Shuddhi is 6 to 7 Vega. Then Virejana Vegas. Kanishta Shuddhi or Avara, that is 2 Vega. Only 2 times the patient has passed the Virejana, then it is Kanishta Shuddhi or Avara Shuddhi. So the how much amount of dosha nirharana? 1 prastha. Madhyama Shuddhi is 3 Vega, 2 prastha dosha nirharana. Uttama Shuddhi is 4 Vega and 3 prastha dosha nirharana. So the quantity of the dosha is 3 prastha, then it is Uttama Shuddhi. So this is the Shuddhi Krama of Vamana Virejana according to Kashyapa. Okay, then सुश्रुतोक्त पृष्ठ दग्धा को वाग्भटा ने तुत्त दग्ध नाम दिया है. Okay, according to Sushruta, there is 4 types of dagda is there. Okay, 4 types of burns are there, dagda. So in that Plushta dagda has mentioned by Sushruta. Okay, Sushruta has mentioned 4 types of burns. Okay, so first one is Plushta dagda. So same is accepted by Vagbhata, but instead of Plushta he has mentioned Tutta dagda. Okay, he has given the name Tutta dagda. Tada Susrudokta Idaradi dagda ko Vagbhata ne Pramada dagda naam diya hai. And another one more term which is told by Susruta, that is Idaradi dagda. Idaradi dagda means you can get burns due to lightning. Okay, due to lightning, thunder and lightning is there, no? So due to lightning you can get burns. Okay, due to the excessive heat. Okay, due to the smoke. Okay, due to the smoke you can get burns. Okay, so this type of burns comes under the category Idharadi Dagda. The same thing Vagbhata is also mentioned, but he has given another term Pramada Dagda. Okay, so these are the 2 terms which is told by Vagbhata. Instead of Plushta he has mentioned Tutta Dagda. Instead of Idharadi Dagda he has mentioned Pramada Dagda. So these are the 4 type of burns, therapeutic burns, or 4 types of dagda. Plushta, Durdagda, Samyak dagda, Adi dagda. Okay, Plushta dagda means it is a simple touch. Okay, simple burn. Simple burn is Plushta dagda. So if it is a simple burn, then what are the symptoms you will be getting? Vivarna, there will be discoloration of the skin will be there, excessive singeing, like excessive burning sensation will be there. Okay, so if you just touch a fire, just a simple burn, okay, simple burn, so that time discoloration of the skin will be getting and excessive burning sensation will be there. So here which treatment you have to do? Agni Prapadanam, Ushna Ushada. So here Ushna Ushada, Ushna treatment you have to give in this condition in Plushta Dagda. Very, very important. Ushna Chikitsa has to be followed in Plushta Dagda. Durdagda, which that is much more deeper version. Okay, not as a super. Plushta is a superficial burn. Okay, Durdagda little bit deeper, like a little bit skin is getting involved in the burn. Then Tivra Spota, you will be getting vesicle formation, Shosha, Daha, Raga, Paka. Inflammatory changes will be there, vesicle will be forming and burning sensation, redness of the skin. So these are all you will be getting in the Durdagda. So here which treatment you have to follow? Shida, Ushna Kriya. So Shida and Ushna both you have to give in this condition. Plushta Dagda, Ushna Chikitsa, Durdagda, Shida, Ushna Chikitsa we have to follow. Okay, Shida, Grida, Lebana, Seka, these are all should be done in the Durdagda condition. Then Samyak Dagda, if you have burnt properly, if you are doing Agni Karma, you have burnt that area properly, then Anavaghadam, it will not go deeper. Tala Varnam, so that burnt area will be Tala Varnam. Susamstidam, all the areas will be in a normal level you will be getting. Okay, so here Ushna Chikitsa, like Pitta Vidridi Chikitsa, very, very important. So in Samyak Dagda, you have done Agni Karma, you have got the problem of Samyak Dagda Lakshana. Then afterwards, which treatment you have to follow? Pitta Vidridi Chikitsa has to be followed. Very, very important. Okay, so Pitta Vidridi Chikitsa is indicated in the Samyak Dagda. And the fourth one is adidagda, excessive burning. Okay, when excessive burnings are happening, mamsa avalambana, there will be mamsa will be coming out, there will be tearing of the mamsa will be there, gatra vislesha, there will be tearing of the body parts will be there, rudha vivarna vrana, like severe deep vrana will be there, jwara, murcha, daha, pipasa, vedana in siras, nayu, asti, sandhi. So in all the joints also, joints and in the bone, in all these areas you will be getting severe pain. Okay, so this is a deeper burn. Okay, so that is called adidagda. So here which chikitsa we have to follow? Shidala chikitsa, pitta visarpa. Okay, here pitta visarpa chikitsa has to be followed in adidagda. Okay, so pitta vidridi chikitsa is indicated in samyak dagda, pitta visarpa chikitsa is indicated in adidagda. Okay, shida ushna chikitsa in durdagda, ushna chikitsa has to be followed in plishta dagda. These are the 4 types of burn which is told by Sushruta. So instead of plishta, Vagbhata has mentioned tutta dagda. The name only different, symptoms are same. Okay, so these are the 4 types of dagda we can see. Okay, plishta, durdagda, samyak dagda, adidagda. So chikitsa is more important. Okay. Next one is Shuddha Rakta Lakshana, that we have already studied the shlokas. According to Charaga, Tapaniyam Indra Gobhavam Padma Laktaga Sannivam. According to Sushruta, Indra Goba Pradigasham Asamhadam. These are the qualities of the Shuddha Rakta Lakshana. Then Aleba. Okay, Lepana Karma Sadhana, we are applying the paste in the paste applications in the body. So that is according to Sushruta, 3 types are there. Praleba, Pradeha, Aleba. Okay, Praleba means very thin layer of paste application, very thin layer. Okay, with the Shida Dravyas, if you are for creating the Shidatva in the body, and Thanu, very thin layer. Okay, very thin. In the face mask is all Praleba. Okay, very thin layer. Okay, so very thin layer if you are applying, that is called Praleba, that is a Shida Dravya. With the Shida Dravya we are applying, with the Shida Dravya you are making the paste, and very thin layer if you are applying, that is Praleba. Pradeha is Ushna Shida. Ushna and Shida both are mixed together, we are applying. It is little much more thicker version. Okay, Bahala, Gada, it is much more thicker than the Praleba. So it is a Vada Sleshma Prashamana Karaga. It is usually given for to reduce the Vada Kapha dosha. Those who are suffering with the Vada Kapha related with the swelling or pain are there, you can give Pradeha. Okay, Shida Ushna mixed treatment you are giving, and it is thicker than the Praleba. Aleba is Madhyama. Okay, between the Praleba, Pradeha it will be coming. Thinner layer is Praleba, thicker one is Pradeha, and medium. Okay, between the it is not thin and it is not thicker. Okay, that is Aleba, that is Madhyama. This is usually given for the Avidagda Shofa, even Dakta Pitta. Okay, for the Shofa, those are having this edema. Okay, those are having this non-pitting edema, and those are suffering with the Rakta Pitta. In these conditions, you should be given Aleba. Okay, based on the thickness, 3 types are there: Praleba, Pradeha, Aleba. So Praleba is a Tanu, Pradeha is Gada, and Aleba is Madhyama. Okay, Vrana par lagaye gaye Pradehi ki kalkaya Niruddha Aleba bhi sapnya hai. So in for Vrana also we used to apply kalka. Okay, so in the form of Pradeha we will be giving, so that is also known as Niruddha Aleba. Okay, the kalka used for Vrana. In Vrana we will be applying the kalka for healing purpose. Okay, so for Vrana Robana we used to apply kalka, and that will be in a thicker way we will be applying. So that is also known as Niruddha Aleba. Then for the preparation of Aleba we used to add Sneha also. So for each condition, if it is a Pittaja disorder, if you are putting Sneha in Aleba, that should be 1/6 part you have to add. Okay, so you are preparing an Aleba. So in the preparation of Aleba you are adding Sneha. Okay, maybe Grida, Taila, anything you will be adding. So if it is a Pittaja condition, if you are preparing Aleba, so how much Sneha you have to add? 1/6 part. For Vadaja 1/4 part. For Kafaja 1/8 part. In Niruha Basti we have seen how much Sneha we are adding. Now in the same way for the preparation of Aleba, how much Sneha we are adding? For Pitta 1/6, for Vada 1/4, for Kapha 1/8 part. Then according to Vagbhata, Praleba, that is Ghada and Ushna, it is exactly opposite. Okay, so Praleba according to Vagbhata, it is Ghada, very deeper, and it is Ushna and Vada Kapha Nashaka. Okay, Sushruta, what they have told, exactly opposite is told by Vagbhata. Okay, so praleba means according to Vagbhata is Gada, and it is with the Ushna Dravyas we are preparing, and it is Vada Kapha Nashaka. Pradeha means it is very thin layer, that is Shidala and Pitta Nashaka. Okay, so Pradeha will be used for the face mask, all those things. So that is called Pradeha. Okay, it is a very thin layer, and it is Pitta Nashaka, and it is Shidala. Then thickness of the aleba. Okay, how much thickness you have to keep it. According to Sushruta, ardra mahisha charma ulsed. Okay, the skin which is removed from the mahisha, no, buffalo. So the skin which is removed from the mahisha, that if you are putting into the water, so the soaked, then it will be some thickness will be getting. So that much thickness. Okay, so thickness as wet buffalo skin. Wet buffalo skin. Okay, so that much thickness is the aleba thickness. Okay, thickness of the aleba according to Sushruta is telling thickness as wet buffalo skin. Ardra mahisha charma ulsed. Okay, according to Charaka, tribhaga angushta. Angushta ke 1/3 bhag jitna mota, so like 1/3 part of the thumb. Okay, how much thickness is there? That much thickness should be need for aleba. 1/3 part of the thumb. Angushta is thumb, thumb, thumb. Okay, so the 1/3 part of the angushta, how much thickness is there? That much thickness you have to put, that is the thickness of the aleba. According to Sushruta, ardra mahisha charma ulsed. According to Charaka, tribhaga angushta. So these are the thickness according to each acharya in aleba. Then according to Sharangadra, this one is important. Most of the time questions we used to get from these area. If Doshakna Leba, Vishakna Leba, Varnyagara Leba, like that 3 classifications as mentioned by Sharangadra. For Doshakna Leba, how much thickness we have to put? 1/4. Vishakna Leba 1/3. Varnyagara Leba half angula. Okay, very important. This is very important. Okay, so for the Doshakna, if you are putting Lebana 1/4 angula thickness you should be putting. Vishakna 1/3 angula, Varnyagara half angula thickness should be put. Okay, so very important. Next one is Ashtamahagada. Ashtamahagada means the disorders which is very difficult to treat. Okay, 8 disorders are there. According to Charaka, which are the 8 disorders? Vadavyadi, Apasmara, Gulma, Shofa, Udara, Kushta, Madhumeha, Rajayakshma. These are the 8 conditions which is very dreadful disorders. Okay, Vadavyadi, Apasmari, Gulmi, Shofi, Tada, Udari, Kushticha, Madhumehicha, Rajayakshmi, Chayo, Naraha. According to Sushruta, he is also mentioned Ashtamahagada, but some conditions he has eliminated and some are he has added. Vadavyadi, Pramehascha, Kushtamashro Bhagandaram, Ashmari Mudagarbhacha, Tadeva Udaram Ashtamam. Okay, Vadavyadi is there. He has removed Abasmara, Gulma, Shofa. Okay, this type of conditions he has removed. Okay. Abasmara, Gulma, Shofa, these 3 things he has not mentioned. Instead of that, he has mentioned Ashras, Bhagandara, Ashmari he has added. Ashras, Bhagandar, Ashmari. Then Muda Garbha. Okay. Then instead of Madhumeha, he has mentioned Prameha. Okay. Then instead of Rajayakshma, he has mentioned Muda Garbha, like that conditions. Okay. Udara, all the things are same. So these are the Ashtamahagada according to Sushruta. Vadavyadi, Prameha, Kushta, Ashra, Bhagandara, Ashmari, Muda Garbha, Udara. Then Chadushpada Krama. Okay, so according to Charaga, according to Vagbhata, it is same only. Chadushpada Krama, that is Vishak Dravyani Ubastada Rogi Pada Chadushtem. So we have to give importance to the Vishak, and the second one is Dravya, that is Aushada, and the third one is Ubastada, that is Paricharaka. Okay, then the fourth one is Rogi, patient. These are the Chadushpada Krama. Okay, like what are the things which is required for the this practice? Okay, clinical practice. First one is physician has the importance, and the second one is Aushada is the importance, and the third one is Paricharaka, and the fourth one is Rogi. This is the order of Chadushpada according to Charaka, according to Vagbhata. Okay, but Sushruta has first of all he has given importance to Vaidya, that is thing, and the second one he has given importance to the Rogi, Vyadi Upasrishtascha. Okay, according to Charaka, according to Vakpata, Rogi comes the last position. But according to Sushruta, Rogi comes the second position, Vyadi Upasrishta. Then third position is Bheshaja and the fourth position is Parijaraka. Okay, Rogi comes in the second and Dravya, then Parijaraka comes as third and fourth. This is the order of Chadushpada Krama according to Sushruta. Okay. According to Bhela, Bishop ko अंत में माना है. Bhela also mentioned Chadushpada Krama, but he has given importance to the physician in the last. Okay, rest of all the acharyas are giving importance to the physician in the first place, but he is the only person he has given importance, Bishop in the last place. Okay, so just understand Charaga, Vagbhata, they are following the same Chadushpada Krama, Bishak, Dravyani, Ubastada, Rogi, Pada, Chadushte. Sushruta has given importance Rogi in the second position and third and fourth will be coming Beshaja and Paricharaka. Then, Balaka Anumana, how we can assess the Bala. Okay, Bala of the body, how we can assess it. According to Charaka, Vyayama, by doing the exercise we can, like by doing the physical work we can assess how much the Bala of the patient. According to Sushruta, Vyayama and Sthirada. Okay, Vyayama is also there, plus how much stability patient is having, accordingly we can assess the strength. Okay, so according to Sushruta, from the Vyayama we can assess it. According to Charaka, from the Vyayama, according to Sushruta, Vyayama and Sthirada. Then one quotation they have mentioned, Akriyayam dhruvam mrityu kriyayam samshayo bhavet sandarbha. Okay, this is one quotation which is told by Charaka and Sushruta. Okay, Akriyayam dhruvam mrityu kriyayam samshayo bhavet. Okay, Akriyayam dhruvam mrityu, which means patient right now in a critical condition. Okay, this is the only treatment you can give. Okay, Akriyayam dhruvam. Okay, this is the only treatment that you can given to the patient, and otherwise if you are not giving, this patient will die. Kriyayam samshayo bhavet. If you give this treatment, the patient will get cure. Okay, like this one quotation has mentioned. Okay, the patient right now is in a critical condition due to some of the disorder. Patient right now in a critical condition. If you give this, if you are not giving only if he wanted to make cure. Okay, if the patient has to cure, he has to take this treatment. Okay, otherwise patient will die. Okay, if he takes the treatment, patient will cure. If he is not taking, definitely patient is going to die. If he takes this treatment, patient will cure from this condition. Okay, that is the meaning of this quotation. Akriyayam dhruvam mrityu kriyayam samshayo bhavet. This quotation mentioned in which all the situation it is asked. Okay, so according to Charaka, this context has mentioned in the Sannipadaja Udara Roga. Okay, Charaka has mentioned this quotation in Sannipadaja Udara. In Sannipadaja Udara, it is a very severe condition. Only the treatment we can give is cobra venom. Okay, to treating the Sannipadaja Udara, the main treatment we have to give is cobra venom, Sarpa Visha. That is the only thing that we can give. Okay, with that only we can treat the Sannipadaja Udara. Okay, if we are not treating with this cobra venom, what happen? The patient will definitely die. If you give this visha to the patient will recover from that condition. Okay, so only treatment we can given for the Sannipadaja Udara is Sarpa Visha. If you are not giving, then what happen? Patient will definitely die. Okay, if you give, patient will cure. Okay, so before giving the Sarpa Visha, we have to take the permission. No, we have to tell the family. We have to tell all the things to the family, friends, relatives. We have to explain this. Sometimes doctors used to, when it is a severe condition, doctors used to come and tell, no, this is the condition. This is the only treatment that you can save your patient's life. So I need that. Consent from you people. So if you give this treatment, patient will definitely he can cure from this condition. Like that doctors used to tell, no, the same thing. The same context he is telling, Akriyayam dhruvam mrityu kriyayam samshayo bhavet. So this quotation Charaka has mentioned in Sannipadaja Udara, because in Sannipadaja Udara we have to give Sarpa Visha for the curing purpose. For giving the Sarpa Visha we have to take the consent from the family, friends and relatives. So that time this Charaka has mentioned you have to tell the family this is the only treatment you can give, otherwise the patient will die. If you give this Sarpa Visha to the Sannipadaja Udara Rogi, so patient will definitely get cure from this condition. Okay, so like that quotation he has mentioned in Sannipadaja Udara. In Sushruta also the same quotation you can see, but he has mentioned this under Ashmari Prakarana. Okay, in Ashmari condition Sushruta has mentioned, because in Ashmari means we can correlate with the renal stone formation, okay, urinary stones. So this sometimes with the medicines we can cure the Ashmari, okay, with the medicines, with the Kshara Karma, okay, with the Basti, okay, like that we can cure the Ashmari. But sometimes we will be getting stone formation, like a bigger size stones will be forming, no, with the medicines, with the Kshara, with the this Basti, all those things, it is not going, and patient is getting severe urinary problems and bleeding is happening. So in these condition only treatment is surgery. Okay, so that time Sushruta is telling this we have to tell to the relatives that if you don't do surgery right now, during the surgery remove the stone. If you're not doing right now, patient will die. If you do the surgery, patient will recover. Okay, in that way he has mentioned this context in the Ashmari Prakarana. Okay, so Charaka has mentioned this quotation in Sannipadaja Udara. Sushruta has mentioned this quotation in Ashmari. Okay, so if it is a bigger Ashmari has formed and with the medicines or with the treatment it is not getting cure and the patient is getting severe symptoms, and to make them recover from this condition we have to do surgery. That is the only option. So do the surgery, remove the stone, and then patient will become recover. So that time patient this Sushruta has mentioned this quotation. Okay, akriyayam, if you are not doing, patient will die. Kriyayam, so if you do this treatment, patient will recover. Okay, so that context has mentioned Charaka in Sannipadaja Udara, Sushruta has mentioned in Ashmari. Harida also has mentioned the same context and he has mentioned in Jalodhara. Okay, next one is Phalome Sreshta. Okay, which are the Sreshta Phala? According to Charaka, Draksha. According to Sushruta, Amlaki. According to Vakbhata, Draksha. So these are the Sreshta Phala according to each Acharya. Next one is Vaishajya Kalpana related. Vilebi Bahu Sikta Syat Yavagur Virala Drava. Okay, there is 4 types of Kalpanas are there. Peya, Vilebi, Manda, Peya, Yavagu, Vilebi. Okay, these are the 4 Kalpanas we can see, like Pathya Kalpana. Manda, Peya, Yavagu, Vilebi. Manda means there will be more water content will be there. Okay, Manda means more water, which means it is a watery thing. Okay, the liquid is called as Manda. Okay, the liquid is called as Manda. Okay, Peya means in the liquid little bit of rice will be there. Okay, rice will be present, like some solid particles will be there plus more water, that is Peya. Okay, Manda means it will be water only. Liquid part is called as Manda. Peya means liquid is also there, solid particles are there, but solid particles will be in a less quantity. Okay, that is Peya. Okay, thin gruel, THIN, thin gruel, GRUEL. So here more water, little bit of solids will be there. Yavagu means it is a according to Sushruta. So you can see here Manda, Peya, that is 2 things. Okay, according to Sushruta, Vilebi. Okay, Manda, Peya we have seen. Manda means it is a thin water. Peya means water plus solid is there, but solid will be very few. Okay, according to Sushruta, next one is Vilebi. Vilebi, Bahu Sikta. Sikta means rice. Okay, Bahu, more rice will be there, less water content, that is Vilebi according to Sushruta. Okay, Manda, Peya is same for all the Acharyas. In Vilebi, there is a difference of opinion you will be getting. Vilebi, according to Sushruta, Bahu Sikta, which means more solid is there, less water content will be there. Okay, both are present, but you will be getting more water, and this water is also present, but in a very little quantity, that is vilebi. Okay, bahusikta. And yavagu means, according to Sushruta, virala drava, there will be more solid, which means there will be this water content will not be there. Okay, virala drava, which means very like that much it is not there to say for its water is present, like that it is not there. Only solid will be mainly solid particles only we can see, that is called yavagu. Okay, manda means thin water, peya means water and solid particles are there, but water will be the more, solid will be very less. Vilebi, according to Sushruta, more solid particles are there, less water content. Okay, bahusikta means more solid. Yavagu means virala drava, there will be solid particles only there, water is not at all there. Okay, yavagu virala drava. So that is the vilebi yavagu definition according to Sushruta. Okay, exactly opposite thing is told by Sharangadra. Okay, Sharangadra is telling yavagu is bahusikta. Yavagu means more solid thing and less water content is yavagu according to Sharangadra. Vilebi means virala drava. Okay, which means there will be solid particles are there only, water content is not there. Okay, so what is Sushruta has told, exactly opposite thing has told by Sharangadra. So manda, peya, yavagu, vilebi. So in this order you can study. So manda means thin water, peya means more water, less solid particles, yavagu means there will be vilebi means more solid and less water. Yavagu means virala drava, there will be water content is not there, only solid particles will be there. This is the order of Sushruta. Okay, so yavagu, vilebi, exactly opposite of Sushruta is told by Sharangadara. Okay, next one is kloma. Okay, so each acharya like Gangadhar Roy, okay, he has mentioned kloma is puppusa and unduga. Okay, he has considered kloma is puppusa and unduga. Ashtanga Hridaya Chakrapani, these Chakrapani has told that kloma is Hridaya. Okay, according to Gangadhara, kloma is puppusa and unduga. According to Chakrapani, kloma is Hridaya. According to Delhana, kloma is Pittashaya. According to Gananadasan, Khanda Nadi, Shwasa Nadi, these are the kloma. Okay. Next one is Agada related topics they have mentioned. Sarpanga Abhihada. Okay, Sarpanga Abhihada means there is a sparsh of sarpa. That is only happened. There is no bite mark. The sarpa has not bitten, just sparsha. Okay, sarpa has just sparsha, like just a touch. Okay, touch of a sarpa, that is called sarpanga abhihada. Okay, there is a sarpa sparsha, that is only happened. There is no sarpa damsha, nothing has happened, just a touch of a sarpa, that is called sarpanga abhihada. So that time what happened, there will be excessive vada dosha prakopa will be happen, and the patient will be getting swelling in that area. That is called as sarpanga abhihada, because the sarpa is coming and just they will be passing from our body. Okay, so that time we will get fear. Okay, so due to that what happens, suddenly vada kopa and there will be swelling will be appearing, that is called sarpanga abhihada. Okay, so there is a sparsha of the sarpa is happening, there is nothing. Okay, no bite, nothing. So just a touch of a sarpa will be happens, and because of the fear suddenly vada dosha prakopa will happen, and that particular area swelling will be generated. That is called sarpanga abhihada. Next one is shanga visha. In shanga visha means we have a doubt that a snake bite is happened or not. Okay, you will be walking through the late night, because in the late night there will be light will not be there, so it will be full dark. So that time you will be hitting some tree or something. Okay, some branches will be touching our legs, so suddenly we will be thinking that a snake bite has happened. Okay, so doubt will be generated. So that time also what happened, vada dosha prakopa will be getting, and you will be getting sarpadamsha lakshana, that is called shanga visha. Okay, you are getting a doubt you have, because you will be walking through the andhagara, you are walking through the night time, so there will be no light at that time. So maybe some touch from the tree, or maybe something. Okay, so something will be moving from your legs, so suddenly you will be thinking that snake bite has happened. So there is a doubt in the snake bite. Okay, so because of that, what happened, you will be feeling severe fear, and vada prakopa will be happening. Sarpa visha damsha lakshanas you will be getting. Okay, sarpa damsha lakshanas you will be getting, so that is called shanga visha. There is a doubt in the snake bite, and because of that you are getting sarpa damsha lakshana, because of the mental stress. That is called shanga visha. Sarpanga abhihada means there is a touch of the sarpa is happen. Okay, so in both the condition, vada prakopa is happening. So sarpanga abhihada, it is told by Sushruta. Shanga visha, which is told by Charaka. Okay, next one is sarpa visha achushanata. If there is a sarpa visha is happen, so we have to suck it out, the sarpa visha. Okay, so for sucking the sarpa visha out, if there is a sarpa damsha is happen, visha has entered in your body, so we can do achushana, like we have to suck out the blood. Okay, so if you suck out the visha from the body area, so the patient will get the sarpa visha lakshanas will get reduced. Okay, so by doing the sucking, so before sucking, so the person who is sucking, person who is doing achushana, Charaka is telling mukh mein mitti or aata barkar kare, which means in the mouth should be filled with the soil. Okay, mouth should be filled with the soil, and then you should do the achushana, so that visha will enter into the soil, and that person who is doing achushana, he will not get the sarpa visha. Okay, the poison will not enter into that person's body. So to avoid that, so the mouth will be filled with the soil, and then he has to do achushana. Then sarpa visha will not enter to that person, and that person who has got sarpa visha that activity will reduces. Okay, according to Sushruta, he is also mentioned achushana, but he is told mukhame vastra bharkar, which means in the mouth you should keep the cloth, and then you should do the achushana. So the visha will enter into the cloth, and that person who is doing the achushana, he will not get the visha lakshana. Okay, this is the achushana prayoga told by Charaka and Sushruta. Charaka is telling by mukha should be filled with the soil. According to Sushruta, mukha should be filled with the cloth. Okay, then you have to do achushana. Next one is Navayasa Loha. So this is a yoga which is mentioned by both Charaka and Sushruta. Navayasa Loha has mentioned both Charaka and Sushruta. Charaka has mentioned Navayasa Loha in Panduroga. Sushruta has mentioned in Prameha Pitaka. Okay, so that is very important. So Navayasa Loha mentioned by Charaka in Pandu. Sushruta has mentioned in Prameha Pitaka. Next one is Mahasneha Prayoga, like in which all the conditions you have to give Sarpi, Taila, Vasa, Majja. Okay, so according to Charaka, Sarpi should be Pitta Anilahara. Okay, it reduces Pitta dosha, Vada dosha. Okay, Sarpi reduces Pitta Anilahara. Rasa Shukra Ojasam Hidam. So it is a good for all the dadus. Nirvapanam, Mrudukara, Swara Varna Prasadaka. So it will increases the voice complexion. It will increases the it will increases the voice, and it will increases the complexion. Okay, for those who are having some difficulty in the speech, you can give Sarpi. Okay, Swara Varna Prasadana is Sarpi. Okay, so it is action is Pitta Anilahara. It reduces Pitta dosha, Vada dosha. Okay, this is according to Charaka. According to next one is Taila. Taila is Vada Shamaga Magar Kapha Vardaga Nahi. So very important. What is the action of the Taila? It reduces Vada dosha, but it will not increase Kapha dosha. Because whenever there is Vada is reducing, Kapha will increases. That is the normally we used to see. Vada increases, Kapha decreases. Okay, these are both are opposite. Like whenever Vada is increasing, Kapha reduces. Okay, Vada reduces, Kapha increases. Okay, this is the thing usually happen. But Taila, what they will do? They reduce Vada dosha, but at the same time it will not increase the Kapha dosha. Okay, so that is very very important. So that property it is for Thaila only. Then it is Thaila is Balavardaka, Tvacha Ushma Va Mamsako Sthira Rakne Wal. It is good for the skin and it is good for making the stability for the Mamsa, all those things. And Yoni Vishodaka, very very important. It cleans the Yoni. Okay, so it is reduces Vada dosha, but at the same time it will not increase Kapha dosha. And Thaila is a Yoni Vishodaka, very important. Okay, then Vasa Vidya Evam Bhakname. So for all kind of dislocation, fracture, in all those cases you can give Vasa. Yoni Brahmsha. Okay, that prolapse, vaginal prolapse, in cervical prolapse, in these case you can give Vasa. Then Karna Vashira Shula Nashaka, earache, headache, in these conditions you can give Vasa. Purushartha Vriddhi, Paurusha, okay, to increase the Paurusha. Then Nitya Vyayama Karne Wale Purusho mein Upyogi. So those who are doing exercise daily, okay, those who are doing exercise daily, for them also Vasa is indicated. Then Majja, Bala Shukra Rasa Sleshma Meda Va Majja Ka Vardhana Karne Wala. So Majja, it is usually increases Bala, Shukra Rasa Sleshma Meda Majja. These type of things will increases by Majja. So those who are having Shukra Kshaya, those who are having Meda Kshaya, in these conditions you can tell the patient to drink Majja. Okay, so these are the important qualities of the Sneha. So Pitta Anilahara, it is a property of Sarpi. Swaravarna Prasadana is a property of Sarpi. Thaila is, it reduces Vada dosha, but it will not increase Kapha dosha. Yoni Vishodana, Yoni Brahmsha is indicated in Vasa. Okay. According to Sushruta. Okay, according to Sushruta, what are the properties? Sarpi is Vishartha. Okay, for all kind of Visharogas we can give Sarpi. Okay, so that's why Uttama Sneha is indicated in Visha. Okay, then Hina Buddhi Vada Paitika Vikarome Upayogi. So those who are having less intellectual, okay, those who are suffering with the Vada Pitta conditions, you can give Sarpi. Thaila is Kapha Meda. Okay, those are suffering with the Kapha Meda disorders, and those are suffering with the Krimi Kosha, in that conditions you can give Thaila. Vasa Tivra Akni, those are having severe acne, okay, more digestive power, in that case you can give Vayu, like Vayu ho jiska prana hai aise logo mein upayogi, like those are having Vada Pragoba, in these conditions you can give Vasa. Majja is indicated in Krura Koshta and Vadaja Vikara. Okay, those are suffering with the Krura Koshta, Vadaja Vikara, you can give Majja. So these are the properties of the each Sneha. Okay, then Roga Anusa Sneha Paka, like a different type of Sneha Pakas are there. Mrudu Paka, Madhyama Paka, Khara Paka. Okay. Okay, these are the three Paka we can see: Mrudu Paka, Madhyama Paka, Khara Paka. Like in the preparation of the Thaila and Grida. Okay, in the preparation of Thaila and Grida, there will be Kalka will be there. Okay, so that Kalka, when the Thaila is obtaining, when the Thaila is preparing, the Kalka you have to take it. Okay, so in that Kalka, little bit water content is there. Okay, which means like 90% of water has become removed, only 10% is removing. Okay, so you are like if you're doing the preparation of Thaila and Grida, you are assessing the Kalka, because in between like Paga has attained or not, how you can assess it by checking the Kalka. Okay, by checking the Kalka which is present inside that medicine, you have to take the Kalka in between and just touch the Kalka. If there is water content is there, which means this is has not yet, like Paga has not obtained. Okay, at the last stage, which means when the Thaila is getting forming, when the Grida is getting Paga, so that time if you take the Kalka, if you just touch it and you can feel it, if there is only Ishat Sarasa Kalkas, so only very mild water content is there. Okay, or almost you can just assume that 90% has removed, only 10% or 5% water is there. Okay, so that is considered as Mrudu Paka. When the Kalka is attaining, almost water content has become gone, only little bit water content is there, which means right now this Grida or Thaila, right now it is in the Mrudu Paka. Okay, if you give much more heat, then what happen? The water content will completely disappear. Okay, that Paga is called as Madhyama Paka. Kalke Nirasa Komale. Okay, Nirasa, which means there is no water, it is completely dissolved. Okay, again if you give heating much more time, then what happens? The Kalka will become very hard. Okay, so that Paga is called as Khara Paka. Okay, so this is when you are preparing the sneha, which means when you are preparing grida or while you are preparing taila, we are adding kalka, no, kalka, jala, kshira, swarasa, or medicines, all the things we are adding. Okay, so while or we have put all the ingredients and we are giving heating. So while giving the heating, so if it is attained the proper paka, how you have to know it? So you have to take the kalka. Okay, so in between the heating you have to just take the whatever the kalka, whatever the sediments which is there, that you have to take it, just touch it and feel it. Okay, so if there is water content is there, we can feel it, or otherwise you can just take the kalka, just put it into the fire, so you will get a crackling sound. Okay, that is in crackling sound is getting, which means there is water content is there. So in like half an hour you just take it, or maybe 15 minutes you just take it little bit kalka and just put it into the fire. If it is crackling, which means water is present. So when it become mrudu paka, very little bit water will be there. So if you put very mild sound, you can hear it, so that is indicating little bit water only. Ishat sarasa, little bit water is there. So right now this, it is a mrudu paka. If you give much more heating, that full water content will become disappear. So that time if you put kalka into the fire, there will be no sound will be there. Okay, no crackling sound, that is indicating water has completely disappeared. So which means madhyama paka. Again, if you give heating to the taila or grida, then what happened? The kalka water you are getting, it will become very hard in structure. Okay, like a burned type of things you will be getting. So that is called khara paka. Ishat khadina kalkascha. Okay, so if you are preparing grida or taila, it has attained mrudu paka, then you are closing it. Okay, you are off the fire. So that mrudu paka taila or grida, for what purpose we are using? Charaka is telling it is used for nasya karma. Sharangadra is also nasya karma, but Sushruta is telling mrudu paka sneha is used for the bhojana and pana. Okay, for the internal purpose. Okay, for drinking, for eating, you can use mrudu paka sneha. Okay, if you are giving much more heating, it will become madhyama paka. So that madhyama paka sneha, for what purpose we are using? According to Charaka, panartha and vasti karma, for drinking purpose and for the vasti karma, like niruha anuvasana vastis, you can use madhyama paka sneha. Then Sharangadra is telling sarva karma, for all kind of things you can use madhyama paka sneha. Sushruta is telling madhyama paka sneha is indicated in nasya and abhyanga. Okay, for the abhyanga purpose you are using taila or taila, that is madhyama paka. Okay, or for the nasya karma you are using the taila, that is madhyama paka sneha should be used. That is told by Sushruta. Kharapaka. Okay, so that Kharapaka sneha, according to Charaka, according to Sharangara, both are telling for abhyanga purpose, but according to Sushruta, that is used for the Vasti and Karna Purana. Okay, Kharapaka sneha is used for Vasti and Karna Purana according to Sushruta. Okay, these are the three types of paka and these are the indications of the each paka. So if you are giving nasya karma, which taila has to be used? Madhyama paka taila has to be used. Okay, that is according to Charaka and Sharangara. But according to Sushruta, madhyama paka, for nasya karma, mrudu paka taila has to be used, and that mrudu paka is told by Charaka and Sharangadara. According to Sushruta, madhyama paka taila has to be used for nasya karma. Okay, these are the differences of difference of opinion between these ajars. Charaka and Sharangara almost the same, only the madhyama paka has difference. Charaka is telling for panartha and vasti, Sharangadara is telling it is for sarva karma. Okay, so mrudu paka of sneha is used for nasya karma according to Charaka, pana karma for according to Sushruta, madhyama paka pana and vasti according to Charaka, nasya and abhyanga according to Sushruta, khara paka of sneha is used for abhyanga according to Charaka, vasti and karna purna according to Sushruta. Okay, so Sharangadra ने माध्यम पाक सर्व कर्म हेतु उपयोगी बताया है, शेष चरगवत ही कहा है. So the Charaka and Sharangadra same only madhyama paka you can see some differences. In madhyama paka according to Sharangadra, that is used for sarva karma, for all kind of procedures you can use madhyama paka sneha. Okay, this is the difference you will be getting between Sharangadra and Charaka. Sushruta is entirely opposite things you are getting. Okay, then sneha siddhi lakshana. If you are preparing grida, Okay, Charaka is telling if you are preparing grida, sarpi if you are preparing, like maybe Brahmi grida or Varanadi grida, okay, Triphala grida, this type of grida if you are preparing, when it is attaining paga, when the grida is happening, no, so that time Fena agama will be there, which means frothiness will be started to coming. Okay, while preparing the grida, if frothiness are started to coming, which means the sarpi has formed properly. Okay, now you can sarpi siddha lakshana, which means that a medicated grida has formed. Okay, this is according to Charaka. Then if you are preparing taila, while starting the preparation itself, you will be started to getting that fena, frothiness will be coming. When the frothiness are disappearing, that is the taila siddhi lakshana, which means the taila has become properly formed, like that indication you will be getting. Okay, Fena Agama is Sarpi Siddhi Lakshana, Fena Shanti is Taila Siddhi Lakshana. So while preparing Sarpi, if you are getting the Fena, which means Sarpi has formed properly. In the preparation of Taila, if the Fena is disappearing, that is indicating Taila has prepared properly. Exactly opposite thing is told by Sushruta and Sharangadara. Okay, Fena Agama, it is a Taila Siddhi Lakshana, Fena Shanti is Sarpi Siddhi Lakshana. Okay, this is the opposite thing which is told by Sushruta and Sharangadara. Next one is Garbha Masanumasika, that Vigasa, how the growth and development of the fetus and growth and development of the mother is also happening each month. Okay, so Pradama Masa. Okay, Pradama Masa Charaka is telling Keta Bhuda. Then Sat or Asatta Rupa. So first time when the sperm and ovum is fusing, so that time that embryo will be Keta. Okay, in that form it will be there. Sushruta is telling Kalala Rupa. Kalala means jelly type. Okay, so in that way you will be getting the embryo in the first month. Okay, Charaka is telling Keta Bhuda, Sushruta is telling Kalala Rupa. Both are same only, jelly type of formation. Okay, so Charaka is telling Keta, Sushruta is telling Kalala. In second month, what is happening? This jelly type will become hard, like a muscle type of growth will be happening. Khana Swarupa. Charaka is telling Khana Swarupa, which means it is becoming little bit hard. Okay, so it is like a pinda roba, it will be purusha. Okay, when it become hard, this jelly will be turned into hardness will be attaining. So after the hardness, if it is becoming like a pinda ruba, then it is a purusha. Okay, so if it is a pinda ruba, so the fetus is a boy. Okay, if it is a peshi ruba, the fetus is a stri. If arbuda in that shape, if the fetus is attaining, then that is a napumsaka. Okay, so in the second month they are attaining the some hardness will be getting. So if it is a pinda rupa purusha, peshi rupa stri, arbuda napumsaka. Sushruta is telling the same thing only, like this jelly will be turned into a which little bit hardness will be getting. Then based on the shape, it will be purusha stri, the napumsaka. Then mahabhudom se paga. So here full pancha mahabhudas are attaining in this stage. Okay, then in third month, according to Charaka, Sukha Dukkha Vedana. Okay, so in third month, Sukha Dukkha Vedana, all the things the baby will be getting. Sukha Dukkha Jnana. So that is very important. Sukha Dukkha Jnana will be getting in the third month, according to Charaka. Dauhrida Ulpati, the mother will be started to getting the feelings, the Dauhrida. Okay, so that is according to Charaka, third month. According to Ashtanga Hridaya, it is 2 months. Okay, 3 paksha. Okay, 1.5 months will be coming. So around 2 months. So 2 months Dauhrida Ulpati according to Charaka. So Ashtanga Hridaya. According to Charaka, Dauhrida Ulpati is third month. According to Sushruta, Dauhrida Ulpati is coming in the fourth month. Very important. Okay, so Sukha Dukkha Jnana will be getting in the third month. Dauhrida Ulpati is getting in the third month. Sarvendriya evam Sarva Avayava Ulpati. So in the fetus, all the body parts will be well formed in this condition. Okay, so all the body parts will be forming, and in a minute form it will be happening. Spandana Prarambha, there will be quickening movement will be started to getting in the third month. This is according to Charaka. Okay, so mother will be receiving Sukha Dukkha Jnana, Dauhrida Ulpati, and the fetus will be attaining all organs and all the sense organs in a minute form, and quickening will be starting in the third month. According to Sushruta, Hasta Pada Shira Pancha Pindaka Nirmana, which means Sushruta is also telling same thing, all the body parts are forming. Anga Pratyanga Vibhaga Sukshma. Okay, all the body parts, all the tissue cells, every organs are forming, but all in a minute form according to Sushruta. Okay, in fourth month, what are the things will be happening? Charaka is telling Garbha ki sthirata. Okay, so the Garbha will be attaining the stability, because the first 3 months are very crucial, always will be telling, no? So in the fourth month, what is happening? The Garbha will become stable. So that will be happening in the fourth month. Okay. So Garbhini ka sharir bhar bad jata hai. So the Garbha is getting stable, and because of that, what happened? Garbhini, that abdomen will be started to increasing. Okay. Fourth month onwards, you can see there will be increase of abdomen will be happening. This is told by Charaka. Sushruta is telling Garbha Hridaya Chedana ka Pradurbhava. So Sushruta is telling in the fourth month, for the Garbha will be getting Hridaya. Okay, like Chedana, that soul will be entering, that type of consciousness. Okay, Chedana, Hridaya, these are all will be happening in the fourth month. Garbhini ke Dauhrida Sapnya. So Garbhini, so in the fourth month, Garbhini will be getting Dauhrida. Then Anga Pratyanga Vibhaga Pravyaktada. Like much more development of the Anga Pratyanga will be happening, which means that the development of the body parts will be happening much more evidently you will be getting. In Sukshma will be there in Tridiya, and much more development you can see in the fourth month. Okay, you can see all the body parts you can see clearly in the fourth month. Then in the fifth month, what are the changes will be happening? Charaka is telling Garbha ke mamsa va rekta ki adhika vruddhi. So in fetus will be receiving more mamsa, more rekta will be getting, and because of that Garbhini, what they will be getting? Garbhini krisha ho jati hai. Okay, Garbha is attaining more mamsa and rekta, so because of that, what happened? Garbhini will become krisha, much more slim. Okay, Krisha, it will be because whatever the mother's mamsa and rekta is using. So because of that, what happened? Garbhini will become Krisha, but Garbha will be attaining excessive mamsa and excessive rekta. Okay, then Sushruta is telling Manaha Pradibuddha Dharam Bhavadi. In the fifth month, the mind will be entering, mind formation will be happening in the fifth month according to Sushruta. So this is very, very important. So Garbhini will become Krisha in fifth month. Okay, so that is very, very important. So when all the Garbhini will be getting the changes that they will be asking. Okay, so this is told by Charaka. So Charaka is telling Garbha is getting Mamsa and Rekta Vriddhi. So because of that, Garbhini will become Krisha. Sushruta is telling the Manaha Pradibuddhadaram Bhavadi, that Manas is will be forming in the fifth month. Then sixth month, Shashtama Masa. According to Charaka, Bala ke Bala Varnadi ke Vriddhi. So the fetus is getting more Bala. Okay, Bela, Varna, these are all attaining in the sixth month according to Charaka. Okay, fetus is getting Bela and Varna. So because of that, what happened? Garbhini will be getting Bela, Varna, Hani. Okay, Garbha is getting Bela and Varna, and because of that, what happened? Garbhini will be getting Bela, Varna, Hani in the sixth month. According to Sushruta, sixth month, Shashte Buddhihi. In the sixth month, Buddhi will be producing in the sixth month according to Sushruta. Okay, Garbhini will become Krisha in fifth month. Garbhini will be getting Belavarna Hani in sixth month. Very, very important. And the seventh month, according to Charaka, Garbhe Samburna Bhavam se Pushta Garbhini Klandatama. So in the seventh month, all the organs, all the things will be formed well packed. Okay, in a human body, what are the things are required? All the things will be forming, and the full-fledged human body will be forming. So because of that, what happened? Garbhini will be Klandatama. Garbhini will be getting more fatigue. Okay, excessive weakness will be feeling in the seventh month. Okay, Sushruta is also telling same thing. Sarvanga Pratyanga Vibhaga Pravyakta Taraha. Okay, Sarva, for all the body parts will be forming in a very good manner. You can see all the body parts. Okay, Sarvanga Pratyanga in Sukshma in third month. Okay, Pravyakta in fourth month. Okay, the terms is very, very important. Sarvanga Anga Pratyanga Vibhaga Sukshma, minute you can see in the third month. Much more visibility, Pravyakta, that is in the fourth month. Pravyakta Taraha. Okay, that is you can see in the seventh month. So these words are very, very important. With that words only you will be asking. Okay, so in a minute form, all the body parts you can see in third month. Much more visibility you can see in the fourth month. Whole body parts are forming in a proper way, and you can see all the things. Okay, even the bones also you can see in the anomaly scan. All the things they will be checking now in the seventh month. Third, fifth, seventh month we will be doing the scanning. So in the seventh month, if you do the scan, you can see all the body parts. Even the bones also we can see. Okay, so that much see, all those things will be forming. So Pravyakta Taraha, much more visibility you can see in the seventh month. Okay, Anga Pratyanga Sukshma, third month, Anga Pratyanga Pravyakta, fourth month, Anga Pratyanga Pravyakta Taraha, seventh month. Okay. Then Kashyapa is telling in seventh month Garbha Tridosha Yukta. So Garbha will become three doshas will be attaining in the seventh month according to Kashyapa. So these are the changes. So Garbhini will become Krisha in fifth month, Balavarna Hani in sixth month, Klanda Tama excessive fatigue will be feeling in the seventh month. Okay, then Ashtama Masa, 8th month. Charaka is telling Ojaka Adana Pradana. So in the 8th month, Charaka is telling Ojas is moving from mother to fetus and fetus to mother. Like that, there is a movement of Ojas you can see in the 8th month. Oja Astirada. Okay, that is happening in the 8th month. Sushruta is also telling same thing. Ojoki Astirada Nairudiko Bali. Okay, so there will be movement of the Ojas you can see in the 8th month. 9th month चरक इज टेलिंग 8वें मास के एक दिन पश्चात से ही प्रसव काल प्रारंभ जो कि 10 मास का तक विघ्न रहित माना जाता है. So after the 8th month, okay, after the completing 8th months, after completing 8 months onwards, it is a prasava kala according to Charaka. Okay, so 9 and 10th month is prasava kala according to Charaka. Okay, very very important. So 9th month, the starting of the 9th month onwards till 10th month, it is prasava kala according to Charaka. Okay, according to Sushruta, 9 to 12 is the prasava kala. Okay, 9 to 12 months is a prasava kala according to Sushruta. According to Charaka, 9 and 10th month. Okay, so that's why Charaka has told no Rekta Gulma Chigilsa should be given after 10th month. Okay, so these are the Masana Masika Krama. Okay, very very important. Okay, the rest of the things we'll discuss in the next video.